Hello guys, welcome to Medycoding.com. So this is the lecture for the shoulder joint and this is very important joint, okay? Like hip, knee. So let's get started. So shoulder joint is also known as glenohumeral joint, okay? Because humerus bone and the glenoid cavity both are combined and they form a joint that is glenohumeral joint. This is a synovial joint. We have seen in the previous lecture what is synovial joint, what are the structures of the synovial joint. So since this is a synovial joint, so there should be a synovial membrane, synovial fluid, articular cartilage at the end of the bone, and it is enclosed in a capsule. So all this feature you will see in synovial joint. So the shoulder joint is a ball and socket joint. So what is ball and what is socket? Let's see in this figure. So this is ball and this is the socket, okay? The cavity is the socket and that impression, that outer part is ball, okay? So there are three types of movement with this type of the joint. First, you can rotate, okay? Rotation. The second is the side to side movement. Okay, so you can move little here and here in this side. You can move. The next is forward and the backward movement. Okay, so you can get the forward and the backward movement. So these are the movement of the shoulder joint that is possible. So the shoulder joint is combined by the head of the humerus and the glenoid fossa. So the fossa is the cavity. If you see this word fossa, you can understand there must be some deep depression. So the head of the humerus fit on the glenoid fossa of the scapula. Okay? The shoulder joint is a high mobile joint. Means there is much movement. And because of the high movement, this is low stability. So the common problem or injury of shoulder dislocation because of low stability. So the next is glenoid labrum. Okay, so what is glenoid labrum? It is a cartilage that surrounds the glenoid fossa, or you can say glenoid cavity. Let's see this in this figure. So this is the glenoid cavity. So the rim structure that is surrounding the cavity, that is called as glenoid labrum. So these are the components of glenoid joint. We'll see this in detail. So now let's discuss about the bone in the shoulder and type of joints in the shoulder. So the first bone is the humerus. Okay? So the head of the humerus, that is in the hemicircular shape, so this is connected with glenoid cavity. Okay? So the glenoid cavity is the part of the scapula, or you can say that that is the part of the shoulder blade. Okay? So this is acting like a socket. So the next bone that is involved in the shoulder, that is clavicular bone. That is also known as the collarbone. This collarbone gets connected to the sternum. Okay, so this is humeral joint, we already discussed. Now the second joint, for this location, this is acromioclavicular joint. This is the clavicle bone and this is the bony projection, okay, that is known as acromion. So this is connected to the clavicle bone. That location is known as acromioclavicular joint. So the third joint of the shoulder is sternoclavicular joint, SC joint. So there is the sternum bone and this is the clavicle bone. This point is known as sternoclavicular joint. So these are the bone involvement and the joint of the shoulder. Another very important topic of the shoulder joint, that is the rotator cuff. Okay, so this topic is very important for the surgery coding because most of the times the patient came for the rotator cuff tear. So the shoulder has four major muscles. These are the names of the muscles. The first is the supraspinatus, second is infraspinatus, third is teres minor, and the fourth is subscapularis. All these muscles are fused with the joint capsule. We know what is joint capsule. We have seen this in the previous lecture of synovial joint. So all these muscles give the stability to the shoulder joint and help in the movement. Okay, so now let's see the image of all these muscles. So this is the anterior view of the rotator cuff muscles. Okay, so this is subscapularis from this region. And these muscles here, that location, that is supraspinatus. Okay, so supraspinatus and subscapularis, that is visible from anterior side. And this is the posterior side. This is teres minor, this muscle. This is teres minor. And this, the big muscles here from the posterior, that is infraspinatus. And here again, supraspinatus. Okay, so these are the muscles of the rotator cuff. This is very important for surgery coding interview questions. Now let us discuss about bursa. What is bursa? So bursa are the small sac filled with the synovial fluid. So it is acting like a cushion or pillow. So it reduces the friction between the tendon, muscles, and the bone. So there are mainly three important bursa. Subacromial bursa, as the name suggests, subacromial, it means it is below the acromion bone. So this is very important bursa in a surgery medical coding because physician do debridement of this bursa because of the bursitis and decompression because of impingement in this acromion joint. Okay, so must remember this. Second is subscapularis. Third is subcoracoid bursa. So these are the very, very important bursa of the shoulder. So in total, 8 to 10 bursa in shoulder joint. So this is the end of lecture of shoulder joint for medical coder. You can download PDF by visiting our website. So please subscribe to our YouTube channel and support us for this content. We are working hard to provide you the content for medical coder. Thank you. Bye-bye.